Hi, it's Grace Pike. I'm back with 5Features, and today we're sitting down with Dr. St. Clair at Ozark Dermatology to talk about the most common skin cancer types and what they can do to help you.
My name is Kevin St. Clair, and I'm one of the physicians here at Ozark Dermatology Clinic, and we're here to talk about skin cancer. May is Skin Cancer Awareness Month, and we just like to make the public aware of what to look for, treatment availability, and how to prevent them. There are three common types of skin cancers that we see every day in our practice. The most common by far is called basal cell carcinoma. It's the most common, but fortunately the least aggressive type of skin cancer. The second most common type is called squamous cell carcinoma, which is quite variable in its ability to be aggressive or unaggressive. And fortunately, the least common is the most aggressive, which is malignant melanoma. There are about 3 million cases of skin cancer diagnosed in the United States every year. Fortunately, most of those can be treated readily and cured if they're taken care of in an appropriate manner in a timely fashion. Most of the deaths from skin cancer in this country are from malignant melanoma. So those are very important to detect early because early detection translates into a much better outcome. And the American Academy of Dermatology has come up with an acronym that helps us remember the features of malignant melanoma. And that acronym is ABCDE. A stands for asymmetry. These lesions are usually very heavily pigmented, but they're not uniformly shaped. They have different shapes. I like to think of them being shaped like an island on a map. One side of the spot doesn't look like the other side. B stands for border irregularity. The borders, instead of being smooth and arcing, are very jagged and irregular. Again, think of an island on a map. C stands for color. Not just dark color, but different shades of dark within the same spot. There can also be hues of red, blue, and white within the dark spot. D stands for diameter, generally greater than 6 millimeters in diameter. That's about the size of a pencil eraser. But also important is E, which stands for evolution. These melanomas, they're dynamic tumors. They don't just sit there month after month. They grow and change. So over months, you may notice a change in the size, the shape, the outline, and the color. So if you see any of those features, or if that spot is itching, or certainly if it's bleeding, then you need to see your dermatologist. It's a good idea once a year, just as a routine health screen, to have a dermatologist examine your skin from head to toe, even if you don't see something. So we recommend a monthly self-exam at home. We'll suggest you ask your primary care doctor to look at your back for you while you're there for an annual checkup with that physician. And also, especially if you have risk factors of being fair-skinned, a lot of sun exposure, or have had a skin cancer or a family history of skin cancer, to see your dermatologist annually. In terms of treatment for skin cancer, the primary mode of therapy is surgical removal, to simply cut out the cancer. For most skin cancers on the head and neck, the kind of gold standard therapy for skin cancer removal is a technique called Mohs surgery, and that's spelled M-O-H-S. It was just an individual's name. But that technique, what we do is we cut out the skin cancer. We don't repair the wound right away, but rather the patient stays in the office, the tissue is frozen, cut up, and examined microscopically, and we can tell generally within an hour whether we've removed the entire tumor. And that way, that allows us two advantages with that technique. One is it has the highest cure rate of all the treatment options for skin cancer, but also that allows us to be very tissue conserving because we take a very small margin around the cancer to start with because we're not so afraid of not getting it all. If we don't get it all, the patient is still there in that hour, and we'll just go back and get another small piece, put a bandage back on the patient, and we check it again microscopically. So the idea with that technique, we don't repair or reconstruct any wound until we're confident that we've gotten it all. And that does give you the highest cure rate that's available. Skin cancer is becoming increasingly common, so what can we do to decrease our risk of skin cancer? Well, fortunately, we know the primary cause of skin cancer, and that is exposure over our lifetimes to ultraviolet radiation, which is primarily from sun exposure or sunlight, either occupationally or recreationally, but also we can get damage to our skin from ultraviolet radiation from tanning beds. So some simple measures one can take to protect yourself are trying to moderate your sun exposure. For instance, trying to do outdoor activities before 11 or after 2. The sun is much more intense in the middle of the day than it is at the ends of the day. You can wear appropriate clothing such as long sleeves, long pants, and a brimmed hat If you know you're going to be outside for long periods of time, you can apply sunscreen with an SPF of 30 or higher to areas of your body that are exposed, sticking out of your clothing. You can also wear sunglasses because sunlight is the primary cause of cataracts, so sunglasses decrease the risk of cataract formation. And of course, you want to avoid tanning bed use. Tanning beds increase the risk of skin cancer and are probably the primary reason we're seeing increased rates of skin cancer in young adults. So if you see an area that's concerning you, please give us a call. We'd be happy to see you at Ozark Dermatology in one of our 4 Northwest Arkansas locations. 443-5100 is our main phone number.
Thanks for joining us today, and don't forget to give yourself a monthly exam, and if you need, Ozark Dermatology is here to help.